Okay, we are good.
So, hello and good evening, everyone who are joining us from Pakistan, and good morning to the people who are joining us from the US. And thank you for joining us today. I am Asim Aga, and I recently graduated from Nishtar Medical University, and I'm hosting this session today. I welcome you all the episode 3 of Communication Matters Initiative, an idea led by Dr. Amir Lagari. Unfortunately, he is not here due to his round at the hospital. So, today we will explore the vital role of emotional intelligence in medical school, residency, and fellowship. Beyond medical knowledge, success in these demanding roles requires self awareness, empathy, and strong interpersonal skills. Today, we will try to uncover how emotional intelligence can enhance communication, teamwork, and well being in high stakes medical environment. It's an absolute privilege and honor for me to introduce a multi talented individual whose dedication for both medicine and arts exemplify excellence and balance. Yes, Dr. Sadhu Rahman. Dr. Sadhu Rahman graduated from the prestigious King Edward Medical University in 2018. He completed his USMLE journey during house job, a feat that speaks to his self-discipline and adaptability. He completed his internal medicine residency at Carl Health in Illinois, where he served as a chief resident. His leadership in that role demonstrated not only his medical expertise, but also his ability to mentor, inspire, and connect with others. Few hallmarks of emotional intelligence, I guess. Currently, he is a cardiovascular disease fellow at Leahy Clinic in Massachusetts, where he continues to balance the demands of complex specialty with compassion and empathy for his patients. Uh, Let me tell you that his achievements extend beyond medicine. He's an active researcher and he has presented nearly 10 international and national conferences in past year and a half, including ACC, ASC, and ACP, and many others. But what truly sets him apart is his creative side. Ladies and gentlemen, he is a talented singer, musician, calligrapher. These artistic pursuits reflect his emotional depth and his ability to connect with the people on a deeper level. Today, as we explore the topic of emotional intelligence, we are fortunate to have someone whose life and career truly exemplify its importance. Please join me in welcoming Dr. Sadhu Rahman. Dr. Sadhu Rahman, over to you now.
Thank you so much, Asim. I'm really humbled. You said a lot of good things, but I feel everyone is unique in their own sense. I was fortunate to, share my journey with you all. Thank you so much again. That's really a lot. So we'll talk today about emotional intelligence. As Asim also mentioned, it's the key to personal and professional success. I feel it's very important. It's an underdog. It's not talked about much, but during residency, during any of your interviews, uh, daily life, any profession, it's very important, to emotionally control yourself, to know how to interact with people at the same level. So the contents, let me just this here. The contents for today's discussion will be what emotional intelligence is, understanding what it is actually, components, EI versus IQ, because IQ is something we emphasize a lot. So how it's different than that, and why it's more important than IQ. EI in leadership, how it hones your leadership skills. Then we'll discuss some real world examples. I'll try to make it more interactive during those real world examples. Then we'll go towards challenges, how it's challenging to develop EI. And then we'll go towards the conclusion and the take home steps, take home points. So, what is emotional intelligence? As the word says itself, emotional intelligence is ability to recognize, understand, manage, and influence emotions in oneself and others. So basically, we can define it as having better control of your personality, how you express your personality with different people, how you interact with different people, how being emotional or keeping your emotional component aside from how you interact with people. Uh, and like why it's important. So again, thing is that this is something that you will not only utilize during in your daily life. It will be something you will have multiple times during your day, whether you're a resident, whether you're working in any profession, and even in personal life. So it enhances your personal and professional relationships. It improves communication and conflict resolution. So conflict resolution is something you will face pretty often. Even during interviews, you're having a discussion, someone has a different opinion, how you have to respect their opinion and put your word at the same point. Increase resilience and adaptability. Adaptability is very important. I think when everyone or residency programs are interviewing the residents or the applicants, they want to see adaptability. How good a person is as a listener, how adaptable they are. Then again, linked to better leadership and teamwork. Are you a good team player? Are you a good leader? And it also supports mental health and well-being. So very important. Whatever can influence your mental health, I feel it's one of the most important things. So components of emotional intelligence, these are some of the words we will be going through multiple times because they're very important. So emotional intelligence starts from self awareness. So first thing you need to know is what your personality is. Are you an introvert? Are you an extrovert? Are you an emotional person, overly sensitive person? Because only then you can mold yourself in these scenarios. You need to know yourself the best, because no one is going to tell you. Yes, some mentors will, but you should be the first person to realize how you are as a person. Second, self regulation. So, controlling behavior. So, first, you need to know who you are, then you have to control your behaviors in different scenarios. So, self regulation comes the second step, the second component. Third is motivation. You have to motivate yourself during every step. You have to learn from your previous experiences, you have to put those experiences in your future ones. Fourth is empathy. Now it's more towards, when you're at a leadership or a team player role. Empathy means if there is a mistake by a colleague, you have to be empathetic. You have to know that everyone has their own life. There must be something happening with their life. So empathy is also very important, understanding and sharing feelings of others. And then social skills. So once all four components you have achieved, the fifth one is social skills. Now, building relationships, influencing others, and managing conflicts effectively. So these are five components, starting from knowing yourself to building relationships, is how emotional intelligence moves through. So the reason of sharing this slide, pathophysiology, it's just, it's something that is real. It's not something made up. Emotional intelligence, the limbic system, which is your hippocampus, your amygdala, which is the emotional brain, and the prefrontal cortex, which is the rational brain. So these are the two components in your brain that actually gets polished, like fine motor movements, gross motor. When you play cricket or football, you're polishing your gross movement. When you're playing a guitar, you're polishing your fine finger movements. So similarly, you're polishing your limbic system and prefrontal cortex when you are actually focusing and learning your emotional intelligence skill. So emotional intelligence versus IQ. It's basically my favorite slide. EQ versus IQ. So IQ is something we talk most about. What it is, it's your measure of cognitive abilities. But IQ is fixed. You might not be able to change it. Like if you see, every person is unique in their own way. Some people are very good exam takers. They will study the same, but they will get better scores. You cannot help that. Some people are not good exam takers, but they are very good in social interaction. Some people are have very good clinical skills. So every person have their own strength, but IQ is something you cannot change. It's fixed. EQ, emotional quotient or emotional intelligence, however, is managing emotions and relationships. It can be developed. And believe me or not, in residency, everyone who's there, or in any job, you all are special. How you are differentiated, it's how you interact with your colleagues, it's how you lead a team, it's how you are emotionally stable or not. So success depends more on EQ than IQ. Yes, you need that. It is not possible that you need exams for everything. But again, how do you help it if you're not able to score very high? Some people will score good, some people will not. It doesn't define who you are. But how you can improve yourself. You can improve it with EQ, because part of residency journey is letter of recommendation, and believe me or not, in fellowship residencies they make a whole lot of difference. So, and then again, when you're working on a research project, you're working as a team player, you're working as a leader, how you interact with your colleagues, it's all about EQ. So you can crave your pathway depending on your EQ. So I would say that it depends more on EQ than IQ. Developing emotional intelligence. What are the practical steps that we need? Number one, again, self reflection is very important. Practice mindfulness and self reflection. Seek feedback. So you need honest people, who can give you feedback, who can tell you what you're doing right, what you're doing wrong. And then you have to be an active listener. You have to, realize this fact that there are weaknesses. There are weaknesses in every person. So you have to develop that as well. This will lead to managing stress effectively. And then cultivate empathy. I think these are the things we talked previously in components as well, but there is some redundancy. So that is how you develop emotional intelligence. And again, through lectures, through different talk sessions, you learn something new. Uh, Emotional intelligence in leadership. So again, I feel that the first thing is to know yourself, but at some point you will be having an authoritative position, you will be a leader. So being self-aware, again, adaptable, we talked about, inspire and motivate their teams. Good leaders, they do that. Third is handle conflict with empathy and fairness. We will talk about real life scenarios. There will be two scenarios. I'll talk more about this in those scenarios. And then impact. How a good leader can impact team. It make a whole lot of a difference. It boosts the morale of the team. The productivity is different, and the results are different. I've seen this in the residency as well, that there will be crisis moments, there will be hard patients, patient in shock, there is crisis, there is a nurse, there is a intern, PGY1, who doesn't know how to, like, they are new, they're also learning. So how you as a leader can change everything, and the impact and the results are different. So the positivity is very important. uh, then benefits of emotional intelligence, again, I think improved decision making. You make better decisions when you have better control of your emotions. Stronger personal professional relationships. People think about you, see you as a different person if you can reflect better, if you can think clear. Enhanced conflict resolution. This will come throughout your journey, and you will get questions during the interview sessions as well, that tell me a scenario when you were able to, there was a conflict resolution and you helped the team. So emotional intelligence is the game changer here. A great resilience to stress, emotional stress. If you can handle that, if you can know some skills, it will help with that. And then higher job satisfaction and performance. Obviously, it will lead to that. So real case scenarios here. I like to make it a bit more interactive. If someone can chip in. So I'll go through some scenarios. So this is the case one. Uh, do anyone wants to read this, just to make it more interactive? uh Case one, and we'll go through how you will manage that. So any volunteers we have?
I can do that.
Thank you, Rashid. If you can go
Okay.
forward.
Okay. So, how EI improve team dynamics in a workplace plus leadership skills. So, case number one is during a night shift in a busy residency program, a multidisciplinary team faced a complex case of a patient in septic shock. The team included an overwhelmed intern and stressed ICU nurse and a senior resident acting as the team leader.
Okay, thank you so much. So what we are saying is that this scenario is, I think everyone of us have experienced this, that there is a sick patient, the team, you're a team leader, you're a senior resident, there is uh, a junior resident, who is new to it, there is a ICU nurse who is panicking, usually they are panicking. And how do you think you will handle this situation? What things you will consider to make it a more efficient team? I'll go towards my opinion as well, that how it helps. But anyone, what do you think you should focus here, to make it a more calm, a more positive environment?
I think first thing would be that to better, to go there and be there and ask them to not panic because you, as being the leader, you know how to handle it and you can manage it, so there is no need to panic in this situation. So keeping them informed about the situation is the one thing that should be done.
Yeah, that's very important. Very good point that as a senior resident, you also always have to lead with example. You have to be there. You have to understand the situation. I feel that when I was an intern, the best thing that I felt was my senior resident is there. So that is very important. Emotionally, you have to be there to support, everyone. What else? With you see your, junior resident, how you will interact with them, how will that be? What do you think? Anyone, it can be Rashid, it can be anyone, wants to chip in. What will your first reaction will be when you see a crashing patient and there is a PGY1 and he is, just looking here and there like what to do? So what will your reaction be to him?
I think first reaction would be that I'm talking just as a my common sense. I think first reaction should be that to make him the again the same thing, that to tell him that please don't panic. If you panic, then if the patients or the family, they see that they're gonna be more panic. So the first thing is that I'm here, so we will as a team, we will handle the situation. You just have to do what we really need to do, like go to the patient and see the vitals, and we can devise the steps beyond that then.
Yeah, I think that's the right answer. So, just moving forward, thank you so much, Rajit, for the interaction. So again, the similar steps, self-regulation. So there is a chaotic environment. The first thing will be you have to control yourself in every scenario, in every crashing patient, in every life crisis. You have to gather yourself. I feel it's the hardest job to do because basically what happens is when you become more emotional, your voice changes, your responses, your clarity of thinking changes. So self regulation will be the first thing before you can interact. Second thing is empathy. Everyone is panicking. It is a natural response. You will see that some people will become a bit because time is the key here. And I know that you cannot spend all your time in empathy, but I've felt, I've seen some of my mentors, being more compassionate during this time, and that leaves a lasting impression. Your thought process about that person changes. You want to work with them, you want to learn from them. So those critical moments, being empathetic to all team members will change your personality, will change what people think about you. Third thing is social awareness. So nurses, it will be helpful for the people who are in residency, but you have to be respectful with nurses. Like I know they will have a lot of questions. There will be a lot of pinpointing towards the attending physicians. You are a bridge there. So you have to be a bit diplomatic there, as I mentioned, the conflict resolution as well. And you have to be diplomatic. You have to tell them that you are right. You have to listen to them. You have to tell them that you are right. I understand your concern, and then you can give the reasoning behind that. But it shouldn't be like fighting. You don't have to pinpoint their mistakes right away, because that moment is when everyone will take back things forever. So again, first things, you have to be there, you have to be compassionate, you have to gather your thoughts, you have to be more calm, and you have to be diplomatic there. You have to tell the PGY1, or the intern that, I got your back, do this, tell them what to do. Even if they make mistake, tell them that I have made mistakes as well. I am a person. I have been through everything you are going through, but do this. If they are not able to do, you can take the lead. And after that, you can just talk to them in a very polite way, because I feel that all of us have gone through the similar scenarios. We have made mistakes, and we have learned from them. So I feel the reason I made up, or I came with this scenario was, it will be something at least during your clinical training, as in residency, as a house officer, as a medical officer, these scenarios will come. You have to be empathetic, and you have to talk after that scenario, what things can be done right, in a right way, in a wrong way, but you have to control your tone a lot of times. You can tell them to do things with a softer tone as well. So your tone, your empathy, and your self keeping yourself calm is very important during this time. uh, I think the next scenario is more about before residency, that a lot of us will be going through, like as an observer during a clinical rotation. So anyone else who wants to take lead reading this scenario, and then we'll share the thought process that what everyone thinks about it. Because I feel that everyone of us might have gone through this. Even myself, every one of us have gone through this.
Hi,
I
my
believe.
name is
All right.
Sorry.
Hi, I'm Dr. Muhammad Amadaskar. I will read it. During a clinical rotation, an observer struggled with time management, often missing deadlines for assigning tasks and feeling overwhelmed. Feedback from the preceptor revealed that their multitasking approach was ineffective, leading to incomplete tasks and frustration.
Thank you so much, Ahmad, for reading. So, some of the things you'll be focusing here. Number one, being a good listener, receptive to feedback. It's very important. It's not a personal attack on you. It's something that someone wants to teach you, and you can learn from that. Number two is multitasking. How you can know where things are going wrong. How to be an efficient team manager. These two things, are the most important ones. And third thing is, uh, so you have to know what other person is thinking about at that point. A lot of times, like the preceptor relationship with you, your mentor and your relationship, a lot of times they will not tell you things on your face. Like I feel that there is a culture difference in the US and in Southeast Asia. In Southeast Asia, our preceptors are very blunt. They will tell things on our face, like this is wrong, you are doing this thing wrong. In US, they I would say 90% or more times they will not be as straightforward. You have to know what things are going wrong in that scenario. You can assess that by their tone. Their tone will be more flat when you can actually feel that there is something going wrong. So emotionally, you have to realize, if there is something going wrong or not. Again, self reflection, knowing what things are going wrong. So I feel these are some of the things that I wanted to bring up with this case. So again, you are overwhelmed, you are getting a feedback, you are unable to multitask at this time, and you are waiting for a letter of recommendation for your residency match. So what do you think, it's for everyone who wants to chip in, that how you will perceive or act in this scenario?
Hamad here. I guess the best case scenario is uh, that you can talk one to one with your mentor, because I personally feel that you should go straight about it. You should be very clear and humble, and maintain your tone, and as well as your words, that this has been on my side of life. I have been doing this, and for me, I think it has become a little difficult, and I think I would need some help here. So I think going very straight and talking one to one is the best thing that you can ever do.
Mhm. Yes, I think that's very important. Basically, this is the approach, not only here, but even when you're having a hard time with your teammates. It's always good to the direct one-way communication is very good. You just talk to them directly. A lot of times, there is difference in expectations. Like someone is expecting differently from you, and you do not know those expectations. So that's right. You go, you talk to them. Barrier to communication is the first hurdle in any progress. So I think that's the first step. I think you're absolutely right. So they give you feedback. They are using a bit strong words that they think you're not being able to come on time, or sometimes they can say that you're more quiet, you're not taking they feel that you're not taking a lot of interest. So what your response should be to the feedback? What do you think? Like, because feedback is very important. Even as a resident, as a fellow, you get it all the time. Your feedback, and I feel that a lot of times it hurts a lot. But what do you think? How we should approach for the feedback?
Um, as I guess we should take it positively, because at the end of the day, we might be coming from some other point of view. The preceptor has different expectations from us, and we have not been meeting them. So it's really good to be in those in those feet where you can understand that the other person is having that conflict with you, not because of his personal reasons, but because there have been some difficulties on your part as well. So I guess the best way is to take it positively and, reassure them that I'll try to do whatever I can in my capacity. And if it is you believe that beyond your capacity, you can, I guess, straightforward tell them.
Mhm. I
I
think.
want to add. I want to add something to it as well. Uh, I think the feedback, the perceptor is giving us a favor by giving us a feedback. He doesn't owe us anything, but he is giving us a feedback to improve ourselves. So I think we should thank him at the very first, and then we will say that yeah, we can improve our shortcomings that you are mentioning that. So I think this is something that is more helpful, because we people see ourselves, we don't want someone to ask, someone to tell us that you are doing wrong. We want everyone that uh, everyone should say that you are doing right, and you are perfect, but no one, we are not ready to listen our shortcomings. So I think he's doing a favor to us.
Uh, actually, both very good points by Hamad and Asim. I'll emphasize this point. That's a very good way of approaching, thanking them. I feel I have utilized the same thing because, like, i- i- actually, when we are talking here, it's a different scenario. But when, someone gives you feedback, at first, you feel that maybe you have done something wrong. I think when you thank them, that approach has worked for me a lot. Like when you're like when I was an intern, I think I was a bit more shy. Like if I know about the patient, I will not say that, oh, I might piss off my senior resident that I'm telling something that he has missed. Again, that's a very hard way to communicate. You have to be a bit diplomatic there. You have to tell thing, and then you can always talk to your senior resident. Just talk to them as well that if I can say things, I don't want to overstep you. I don't, because this is also something like that happens during the daily rounds that like the senior residents, they we'll talk about it further, but with this I would definitely go with thanking the preceptor. It works wonders, like the I think you're right that they don't owe you anything. You're right. And if they give you a feedback, that's the opportunity to learn. It's something, they're spending their time on that. Again, personality reading is something very important when you go across, various professions as well. Some people are more extrovert, they like to speak. Some people are more introvert. They don't like to speak much, interact much. You will have and interact with both type of people. Some people have more type A personality. They want to take hold of the scenario. Some people are more receptive. They like more humble people that oh, he gives more space to people. So the issue is you will know about these people but not during the first few days, and that is when you create the impression. There is when emotional intelligence come into play. You have to give some time to develop any sort of relation, either it's preceptor, anyone. Like there will be preceptors throughout the rotation, clinical rotation, they will not give you single feedback. You can always go to them and I was hoping for a feedback, and something like that. There will be perceptors who will give you feedback daily. Doesn't mean you are doing a wrong or a bad job on daily basis. So you have to step back and take couple of days. Just be a good listener, see how the other person is, how he works. Is he a person who likes to chat? Is he a person who doesn't like to talk a lot and he doesn't like people, disturbing his rounds? So just try to give some days to read the person's personality. Once in 3 4 days, and you will hear from the colleagues as well. Like in residency, it happens. Oh, that attending physician, he likes that. That attending physician doesn't like that. So give 3 4 days before stepping up or making direct communication. Once you know about that person, what they like or how they are, then you start doing that. The same thing in this scenario, number one, direct communication. You talk to them. You ask them that what is the expectation. You can actually, before starting the rotation, you can go and ask them what are the expectations, what I'm expected to do during this rotation, so nothing goes wrong. If they give you daily feedback, just see how they want to work. Like, is it a usual thing to get a feedback on daily basis, or it's something you're doing wrong? Main thing is, number one, set expectations. Number two, talk to them directly, direct communication. Number three, be empathetic, read their personality, and give couple of days or some time to respond and making the first move. I think these 3 4 points in every scenario helps, because you'll meet, I think, 1,000 different people during your journey. Every person is different. Not everyone will become your close friend. You will have some good mentors, you will have some bad experiences. So the goal here is to learn from those bad. Everyone will have those bad experiences, not to react at that time. Learn from that experience and be a stronger person. That's the whole point. So I think great responses by Hamad and Asim. I totally agree to what you guys contributed. So again, tendency to avoid asking for help. You have to ask for help. You have to go to them. You have to talk to them and tell about yourself that you're having you just came in from a different country with a different time zone and a different cultural values. You can be you don't have to be like I cannot you don't have to give this vibe that I cannot do it. Depending on the person, you can always tell your challenges, share your challenges in a smarter way. Overestimating task completion, you have to give room to yourself. See, like if you're working on a research project and you just moved to US, you have to give some room to yourself. You have to say no sometimes, because otherwise you won't be able to complete both the tasks. It's okay to say no. I know in my final year of residency I was much more active in research. Currently I have said no to projects because the first year of fellowship is very hard. You're on call back to back. It's not bad to say no. Sometimes it's the best answer. And then emotional triggers, stress from criticism. Don't take criticism, negatively. It's something if you take it negatively, will lead to procrastination, worsening the backlog, which means you're doing bad. It's not like that. Criticism, the constructive criticism, is something very common here, and you will get that. So try to gather yourself, try to communicate, tell your challenges, and don't burden yourself, especially when you're coming from far long, and you came here after working so hard. No one knows your journey better than yourself. So I think giving cutting some slack for yourself is not a uh, bad thing to do. So challenges in developing EI, overcoming biases and preconceptions, thinking that it's something that doesn't exist, managing deeply ingrained habits. It's the hardest thing. Again, not mentioning the names, but during my residency experience, working as a chief resident, what I have seen is I have seen people who are much better clinically than other residents, much better. But in the end, the other person is doing better. Why? Because they're a better team player. They're better at reading personalities, interacting with their colleagues, and leading a team efficiently. Clinical knowledge is good to get you scores, but moving along this path, you have to be emotionally stable. You have to read personalities, you have to interact with them at the same level. Extrovert, introvert colleagues, you have to do so. Deeply ingrained habits, what that means, like if you have a type A personality, some people will have, they like to take hold of the situation. A lot of times your attending physician will not like that. So it's very hard to change yourself technically, but believe me, that will be the best thing you can do. That's the main learning point here. Balancing emotion in high pressure scenarios, there will be something going on back home which will be hard. Every one of us will see that. Obviously we don't know each other's stories. You all are amazing people, you have hard times, but you're going to work. You are working 14 hours daily, and you have something going back home. So how to not emotionally show it there is something you will learn with time, I would say. But just think about it, that you have to do it. It's hard. You can always talk with your mentor. If instead of them perceiving that you're being procrastinating or something, you're not showing interest, you can talk to them directly. But this is also part of emotional intelligence, that at what time, when you're having a break time, when you're uh, not emotionally feeling well and you cannot control it, at what time you have to go and talk to your preceptor, share with them. Because communication is very important. They might not know what is going in your life, and they might perceive something that is not there, like they might think that you are not interested in something. So it's very important how to emotionally not show your emotions during daily work life. And if you need support, then you have to tell, you have to communicate. So everyone is like, an example is, for example, you're having a tough time, and maybe regarding a research project, there is a discussion portion you're writing, and your preceptor asks you, that can you share the discussion portion in 2 days, and you're like, yeah, it will be shared in 2 days. It's not, you're not able to do it because you're having a hard time. So you have to communicate you can always say something like, I will try my best to complete in 2 days, but there is some personal concerns that I'm having at this point. If you're okay, it's a strict deadline or not. If you have to communicate at a very early level, because believe me, telling it that it will be completed in 2 days and not being completed is not good. But communicating in the start, maybe setting a week deadline is much better. Communication at the earlier time is the key here, because people perceiving something because you are not able to communicate is the main barrier. And then continuous learning and self improvement, sometimes I feel come with experience. You will have some experiences, you have to learn from them, and it's a continuous learning process. Even I am learning. My attending physician, the people who are my mentors, who are like really amazing, I think really high of them, they are also making mistakes, they're also learning, everyone is learning throughout their journey. So tools to enhance the emotional intelligence. So again, journaling, reflect on emotional responses and triggers. You can learn from your seniors as well, like how they are doing in that scenario. You learn every day. You can learn from your father, you can learn from your mentor, your elder brother. Everyone can teach you something. So everyone have their own way of managing stress. It is you who has to select what you like for yourself. Again, I say the same thing. When you are in a learning process, even when you are taking your USMLE exams, there will be 10 people who will tell you how to ace exams in 10 different ways. You don't need to tell them, you will not do that. Listen to all of them, listen to all the guidance. Every one of them have succeeded, they all are right. But then you have to sit and reflect that what suits the best for you. Again, for the mentors, there will be 10 people who are on top of the field. You have to select who creates a positive environment for you, who is the person, who are the colleagues you want yourself to be surrounded with, because it can change your thought process. I feel when I came as a PGY1, Amir bhai, he was the chief resident at that time, and I feel he always used to push me, through all the scenarios, like, you can do this, I'm telling you, you will, like, he used to give a really good positive feedback, and I felt that being with him, I was able to maximize my effort. Similarly, other senior as well. It makes a huge difference how emotionally and how smartly you have to move away from negative people. You cannot say on the, I know it's different back home, you can say no, or but there, you should not tell anyone that you do not like them. I would, to be more specific, you don't need to tell them. Just see how you can avoid those people and be in a more positive environment, which gives a more positive reflection and brings the best out of you. Mindfulness and meditation, I would say, for emotional intelligence, you need to have a peaceful mind. Like, when you're back home, do something you like, give some room to yourself. You don't need to work throughout, because mental exhaustion is something develops, and that can also emotionally break you. You have to give some time to yourself. Coaching on mentoring is very important. Gain insights. I'm delivering a lecture here, maybe some other people will do. Listen to everyone, just respond in your own best way. Everyone is different, everyone have their own ways. Listen to everyone, do what you like the best. And then workshop and training programs, again, everything is available nowadays. Future of emotional intelligence, being honest during the interview. So getting an interview is what is on your CV, what is on your personal statements. Connections help a lot, yes, everything is important. Once you get an interview, believe me, what they talk about 90% of the time is ruling out the people they don't want to take. And who are these people? Who are not able to interact well in those 10 minutes. So those 10 minutes are very critical. That's a small time. A lot of times you will not be able to know what they're thinking, right? So I think that is important. The first 1 or 2 minutes is when they will know your personality. I think in that time, not jumping towards anything is the best. Just give them time, be a good listener, see how that person is. Are they talking a lot in the first 2 minutes, or are they more of a, and you can also talk to your senior, your mentors, if there someone is from that program. But yes, when you're sitting in an interview, the person on the other side of the screen wants to rule you out. He's not there to rule you, and you're already ruled in with the interview. They see how the person is good with interaction. Is he something who will not be able to work in a team? Because 12 residents in one program, one resident who is not emotionally stable will change the dynamics of the whole program. So they don't want to take a person who is hard to deal with. That's why they're sitting there. You might have on your CV that you're a very good leader, you're a very good team player, and we should write that. But at that time with your responses, they want to see how you talk. When they say you had a hard colleague, if you're saying, yeah, that was a bad person, I feel no one does that or says that now, but your starting sentence will be, I talked to them, I wanted to know how they are, if they're having a hard time, they want to see that how compassionate you are, how mature you are emotionally, how mature your answers are. So again, that's the future of emotional intelligence. I feel not only medicine, but every profession, that is the key point for all the interviews. They want to see how emotionally mature you are. And never say bad about your home institution. Even if you're in the medical school here, the system, it's exhausting, we know that, but we have more clinical skills here. US is more investigation based system, it's more insurance based system. In Pakistan or in India, uh, main thing is on clinical skills. I think those physicians are much better with physical exams, and you can bring that art to US. So you're offering them something. Never say, because resources are limited, right? The population is like 24 crores or something, and very few physicians. So I think those people are very skillful. Always tell about the positive aspect of everything. Negative things, try to avoid in the interview session throughout. And again, the takeaways from today's session: EI is a vital skill for personal and professional success. It can be developed through consistent efforts. It's not a single day lecture, it's a journey. Emotional intelligence is a journey. It starts from today. For some of us, it has started already for some of us because we have been through so much. And it will continue. You have to groom yourself, you have to keep shining. And then cultivating EI benefits individually and organizations alike. So that's something. I think that is my last slide. I just shared a few pictures. Amir bhai also wanted me to share. So that's my journey being in different conferences. I like to play music. I put some pictures there. Try to do something you like. Enjoy your hobbies. Enjoy your journey. It's hard financially. It's a very long route. It's a marathon. It's not a sprint. It will take years to be there. It took years for me as well. But believe me, it's worth it. Give yourself some room. Be emotionally strong, because that is something that will matter in the end. And I think I'm good, but I'm open to any questions.
Thank you so much, Dr. Rahman. And I would like to encourage the participants to ask questions from Dr. Rahman, and we will be happy to listen to your questions and answer from our speaker. Thank you.
And you can ask about some hard interview experiences, because it's very hard, 10 minutes or 15 minutes, and you have to express yourself. You don't know the other person, you don't want to make a mistake. Or during your clinical observerships, if you have a hard time, I'll be happy to answer those questions.
There is a question
I,
in the chat box from Hasib. He's asking, while preparing for step exams, it does it require to be emotionally strong?
Yes, I would say definitely. So I'll share my experience. When I was preparing steps, what happening was that I was seeing my colleagues. I was doing house job, but the colleagues, they're having some trips, enjoying that. There are family functions. I'm missing all of them. Marriages, those functions. And sometimes, I'm sitting and I'm like, what I'm doing. So USMLE, again, it's a marathon. Uh, it's very hard, to keep on, doing that question bank again and again and you will have some mental exhaustion days when you won't be able to study. So I would say, have someone you can talk to, who is also in the same journey. It helps. Number two, set a mentor, and you look up to them. You can, talk to them, or you can follow them, that, oh, he is doing that, I can do that as well, and you can. So I think these small reminders are very important, because it's very hard when you're leaving all everything and you're just studying the whole time. So yes, it is very important. And at the same time, I would say, try to spend time with the family as well. I feel when you come here in the US, the biggest thing you miss is the family. So and talk to your mom, your parents on daily basis, if you can. A lot of times, I felt that, when I was not able to talk to my mom on daily basis, it was something that I was not realizing, but was building on back of my mind. You can put it, send her a text if you're busy, but try to, communicate with the people you love, because that will be the biggest support in this journey. And my brother as well. He has been very supportive.
Thank you so much. There is another question that please tell the characteristics of a good mentor. Like while we choosing a mentor, for example, a student looking for a research mentor in US.
That's a very good question. Very, very good question. Mentor is very important. So I feel, because every person is different, the first way to select is, when it's like, who inspires you the most. There will be multiple people, but for me, like, I can give my example, because everyone is different. Again, there is a high chance that someone who's my mentor, you might not like that person, but uh, I think, mentor wise, is someone who brings the best out of you. How you know that when you talk to them, they always give you a push, like a positive push, like a positive feedback, like you can do this. You're in a hard time, and someone you feel when you talk to them, is all, like, for me, for example, I'll again, you mention Amir bhai, like, we talk, pretty often, but whenever I used to talk to him, uh, I'll feel really nice, I'll feel very positive. Why? Because, when I'm talking to him, he's like, oh, I have done that, you can do that. Someone who is, who continues to inspire you, who continues to give you a positive environment, and when you talk to them, you feel like you have recharged yourself. There is no right and wrong answer. I will not give you like a, like, calculated thing, like someone who has achieved this, or someone, who can do this and this. There is no right and wrong answers. The simple answer is someone who brings the best out of you, someone who gives you a positive push, and when you talk to them, you feel like you have recharged yourself. I know it's hard to interpret what I'm saying, but I would say that is the person you want to talk to, not someone who's telling you a lot of challenges. Like, uh, I know USMLE, believe it or not, I feel it might have happened to you guys as well, that how USMLE step one, you have to read this. It's not about guidance. Mentor can be one who you get guidance from. That's a different thing. You need to know everything. That's guidance. Mentor is someone who polishes you. Like, he might not be the one who is telling you what NBME to take at what time, because those people you will get everywhere, and they will tell you the right thing. So you will know that algorithm, what to do, what, when. Mentor is someone who brings and makes you more emotionally strong, with whom you can share your stuff, with whom you can share uh, your weaknesses. So someone who you think will not judge you, will bring the best out of you, and you feel recharged when you talk to them, is your mentor. I would say it's that would be my definition. I hope I answered.
It's a very comprehensive answer, I guess. A few more questions here in the chat box. Arshia is saying that is there a room for introverts to showcase themselves in the best possible way in US healthcare system, or you need to be an ambivert?
Uh, it's a very good question. I think, emotional intelligence wise, one of the thing that is very hard is if you're an introvert. Uh, I would say, like, if I give my example, I won't say was an introvert person, but I was a shy person. Like someone who is sitting, in a big gathering, and not able to start the conversation. I feel you have to interact with more people. You have to come out of that box. Why I'm saying that? I'm not saying that personality wise you have to change yourself, but you have to show who you are. Like, you have to express. Otherwise, how people will know how beautiful a person you are? So I would say, try to be more expressive, not change your personality. If you like, a lot of my friends are introvert, and they have done really well. But you have to be expressive. You have to speak at the right times. So ambivert, I don't know if that is the right word to define that, but yeah, because if you're not able to express yourself in US, I feel everyone is very expressive. Yes, some people talk more, some people talk less, but you might have to share your journey. You have to do that because you are special. You have to tell others.
Another question from Dr. Hania. She's asking that is it okay to make mistakes in early days of residency? I feel like I'm going to
I don't know. I think let me read the chat. I think I'm. Are you guys able to hear Asim, or is it me?
We can only hear you.
Okay.
Asim,
Uh, Is it okay to I can read the question actually. Is it okay to make mistakes in early days of residency? I feel like I'm going to make so many of them, keeping in mind the cultural differences and huge differences in the US and the healthcare system and here in the Pakistan doctor. Yeah, very good question. So yes, making a mistake is not a sin. I would say that uh, what important is try to know more about this the environment you'll be working with, because cultural differences are there. What I used to do was, like, might work for you, might work, but I heard that it does work. Number one is try to interact with the people of the same environment early ahead. Like, I think we started residency at on 1st July, but 15th June when I came to US for the first time, I tried to interact with my seniors, or someone I knew in the program, just to know that how is the routine, what are the things they look for in a resident, like in a casual way. Just try to see that what are the important things or pointers that you have to work on more. Again, still there will be mistakes done. Good thing is always say thank you. I think Asim mentioned that point. That was a good point for the feedback. Mistakes will happen. There is no answer I can say that you will not make mistakes, but getting adapt and knowing the expectations beforehand will help, and then moving throughout the journey you will keep on learning. So yes, there is no but mistakes wise as well, it doesn't matter if you make a mistake or not, because you will. What matters most is how you take those mistakes, how you're responsive to that mistakes. Number one is you panic and you think you cannot do it again. Number two is say thank you. Tell them that you were not aware of the situation, it happens like that, you had a different perception, but now you will work on that and you will try to make it better. So I think that's the best way, because mistakes will happen. Just how you respond to that is important. I feel there was all difficult, especially okay, thank you so much. To express yourself is always difficult, especially those who are introvert. How one should think, okay, this characteristic in his personality. Any tips? I would say for introverts, it's a gradual learning process. Try to be with people, again, you like to interact with. See how they interact with, with other people. Like, uh, personality reading is very important. Like, see how the people who are doing well in front of you, you will know some people, who are very good with interaction. Just see how they're interacting. You might not be, you don't need to become them, but you can always learn from them. See how they're responding. I feel a lot of, or every one of us is shy, but you have to learn this skill, because you have to express. So learn from the people you think, and you will know some people who do a bad job in that. That is for sure. You will see that, oh, he said the wrong thing. Like, you do not need to touch the sensitive point of people, like someone who didn't match. You don't need to talk on that topic. I know sometimes you think you're empathizing, but that shouldn't be the first thing you need to talk to them before you know them. So I would say just see how people who are doing well emotionally in front of you interact. Try to incultivate that in yourself. And again, it's a lifelong journey. It will take some time, but the first and the most important step is knowing that you're an introvert. That's the most. So you realize that that's the first step, knowing that there is a room of improvement. So that's the good thing, and then working on that. It will take some time, to change it, because changing a personality is not an easy job. um I feel Zishan is saying you're most welcome. Since you have given so many interviews, please share your interview advice to ACE interviews. Second question, you have one number of awards in residency. What is the pathway? Uh, so for the first question, for the interviews, again, as I mentioned, first 1 to 2 minutes, you don't need to jump on any assumption. Try. So the first thing, prepare yourself before the interview. Read about the person. Do they like research? Do they don't like research? If someone doesn't like research, talking about research will do more harm than benefit. And know about them. Do they like academics? What will be the pinpoints you will be touching? Again, when the interview starts, now you will know about the personality. Now you can know about the interest before the interview, not the personality. Interview starts. Be a good listener for the first 2 to 3 minutes. See how they are. You can talk to a colleague, If you don't have a colleague in that program, then you have to do it yourself. How that person is. After first 2-3 minutes, when you have established a rapport, you have to carry a conversation. You don't have to tell your CV in personal statement. Depending on that person interest, if you're able to start a conversation, your job is done for the interview. They're gonna remember you. But if it's a like computerized interview, they're asking a few questions, you're answering some questions, it might not be that helpful. So you have to know their interest beforehand. You have to give 2 to 3 minutes when the interviewer starts to read what they are saying, and then you have to carry a conversation. Regarding awards, I would say there is no I would say it was more like a blessing. You just have to work hard. Never think about an award. What you're doing already is an award, honestly. Like, you guys are working hard in such a stressful situation. You all should be awarded for that. It's not easy, but winning an award is never in your hands. Just be a person. I think my goal was, and everyone's goal should be, that when you're working, everyone show your personality. Like, everyone should remember you in terms that he's a very nice person, he's a hardworking person, and he interacts with people really well. You have to be a very genuine person there. You have to empathize, you have to be nice, you have to learn from mistakes. If that wins you award in the end, well and good. If not, I would say you should be awarded. So just focus on that once you work in an environment, people should say, oh, that person was amazing. That's the goal. The award is nothing, honestly. uh, Suppose you have to go back in time, second and third year medical student, and you have little experience regarding research. Now you want to have a mentor, research manager. How you define a mentor? Let me understand the question. So second and third year medical school, I have to go and then have a little experience regarding research, and now to have a mentor for a research. Okay, how to find a research mentor? That's the question. So again, it's a hit and miss. I would say there is no right or wrong way. You have to find the right person. You might have to email or text a lot of people, but you will find the right person. There is no shortcut. There are research groups, if you can be, and you meet really amazing people there. So you can try that. But no, it's a hit and miss, honestly. You have to interact with various people. You will like some, you will not like some, and then you will be able to find. No right answer in that. Okay. I think we are good, but I can share my email actually, or maybe here. And if there are further questions, I am happy to answer there. Okay. Yes. And it was wonderful having you all. And you all are winners. You all are amazing people. We all started the same. It was hard, but resilience, keep on working hard, be composed, and be emotionally strong. You're a few steps away from the goal. Thank you so much.
Thank you so much, Dr. Rahman, and thank you all.